I'm Dr. Garima Asati. Welcome you all in my YouTube channel. Friends, today I'm going to explain you about the topic Bell's palsy in English on the demand of few of my non-Hindi patients. So let's talk about what is Bell's palsy. So it is loss of control on muscles, especially of the one-sided. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel. Tap the bell icon to get the latest updates of the videos and kindly see the video till the last, because at the last I am going to tell you some of the homeopathic medicines which can be helpful in curing this Bell's palsy. So let's continue with the topic Bell's palsy. Now, I would like to tell you about the causes of this Bell's palsy, that is facial paralysis. So, facial nerve paralysis may lead to this facial paralysis. There is a nerve called this facial nerve which gets paralyzed. So, it leads to this facial paralysis or Bell's palsy. There may be some viral infections like varicella virus, herpes virus, or meningitis, that is inflammation of the meninges of the brain, may also lead to this Bell's palsy. Along with that, there is Epstein-Barr virus which can also cause this Bell's palsy. Other causes may be trauma to the head or any kind of injury to the head. And along with that, brain tumor or stroke, it may also lead to this Bell's palsy. Then degeneration of the seventh cranial nerve, it can also lead to this Bell's palsy. As a diabetic complication, any kind of emotional disturbances or emotional trauma or any accidental injury to the head can also lead to this Bell's palsy. Now let's talk about the symptoms of this Bell's palsy. So it is mainly one-sided. So one side of the face gets involved, but rarely it involves both sides of the face, and it is called as total facial paralysis. Along with that, muscles twitching may take place. There may be muscular weakness. There is total loss of ability to move one or both sides of the face too. Along with that, there is total loss of taste may also be seen. Patient is unable to taste anything. Pain around ears, continuous blinking of eyes, or there may be droopy eyelids, or there may be patient is unable to hold the eyelid or to lift the eyelid, or patient may be unable to close the eyelids even, and unable to frown, and along with that, continuous shedding of tears from one side of the eye, or there may be complete absence of tears from one side of the eye. And there is increased sensitivity to the sounds also seen in this Bell's palsy. Dribbling of saliva may be seen, and patient is unable to flare up the nostrils, and along with that, there may be pain in the head, and it may be continuous pain, or pain in the neck may be seen, and ipsilateral paresthesia or pain may be seen. Muscular weakness of one side of the body can also be seen in this Bell's palsy or facial paralysis. Now, the diagnostic criteria of this Bell's palsy are MRI and CT scan, which can be helpful in diagnosing this Bell's palsy. Now, friends, I would like to tell you about the homeopathic cause, one of the cured case of Bell's palsy homeopathically, and some of the homeopathic medicines which can be helpful in curing this Bell's palsy. Now, the homeopathic cause is helplessness feeling of that I don't want to face that situation, so just turning my face to the other side. That is the internal feeling of the patient, which leads to the physical illness, and that face gets turned to the other side because I'm helpless to see that situation, so I just don't want to see it. Now, I would like to tell you about one of my cured case of Bell's palsy homeopathically. A patient aged 33 years suffering from this Bell's palsy, having right-sided facial neuralgia, and there is continuous pain in the tooth. and behind the ears there is continuous tearing type of pain, and it irritates him a lot. He is unable to speak, and there is continuous soreness in the throughout the face. There is pain in the neck region too. And after death of his father, he feels he hears his voices continuously, and he feels as if he is lifted up in the air. And there is tormented feeling, there is continuous anxiety and tormented by slightest touch. Effect was after the death of his father, so there is continuous helpless feeling. He sees spirits and ghosts and hears voices of dead people. There was brain fog and he forgets what he intends to say. And the rubric taken was delusion, hear voices of dead people, and the medicine given was Hypericum 200, which cured him completely, but it takes a time of 1.5 years. That's all about this case. Now friends, I would like to tell you some of the homeopathic medicines which can be helpful in curing this Bell's palsy. So the prime important medicine for this Bell's palsy is causticum. So there is a right-sided paralysis of the face seen in this causticum. There is continuous biting of the cheek from the teeth and the tongue. It gets paralyzed, unable to speak anything. And it gets aggravated in cold, and exposure to cold weather, if leads to facial paralysis, causticum will be the remedy for it. And there is general dryness of the mouth. And the mental generals of this causticum are: patient can't support injustice. He can fight for himself and for others too. And there is a continuous fear that something will happen. And he even cries when thanked. So if these symptoms correspond, causticum will be helpful in curing this Bell's palsy. Next medicine is gelsemium, so neuralgia of the face. And if there is sudden acute pain or sudden acute paralysis is there, gelsemium can be helpful. There is pain in the jaw as if it has been stretched to the one side. And there is facial muscle seems to be shortened, as if there is a stretching of the muscles to the one side. Patient feels like that. And there is continuous pain. Along with that, there is dullness, dizziness, drowsiness. Patient doesn't utter to talk. There is lack of courage, anxiety, apprehension, which may lead to diarrhea too. Desire to be quiet and desire slight too. So if these symptoms correspond, gelsemium can be helpful in curing this paralysis, that is Bell's palsy. That's all about this topic. We'll meet soon in next video. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe my channel, tap the bell icon to get the latest updates of the video. And kindly don't take any medicine without consulting doctor. Kindly consult the doctor before that. If you need the clinic address of mine and contact number, it has been given in the description link too. And stay connected to stay healthy. Thank you.